This is EmergencyFD Storyline.
We're trying to keep it where we don't overload the 911 system or anything. Every employee that comes in, they take their temperature before they come into the dispatch center. They're having the facilities commercially desanitized regularly during the day.
From the 911 center to the firehouse.
I think this has been an eye-opener, with this COVID. People need to take it serious, and it's not a hoax. Wear your stuff, be safe, and especially with this COVID-19. I think we would be ignorant if we didn't.
The effects of the COVID-19 here in the United States and around the world.
Even around the stations, we don't hand over between the shifts like we used to, so we're not doing that physical contact or being too close. When you're in the trucks and when you are working, but we're trying to limit that amount of time as much as possible. If one of us do it inadvertently contract it, that we may stop the spread right throughout the whole shift.
The views expressed on this program are from the guests and the host alone, and do not necessarily represent the views of any government agency, private company, or public service. I'm your host, Tom Mann. EmergencyFD Storyline's focus is to tell the stories of those in the fire service and to highlight what matters to our first responders. Whether you're a first responder or a person interested in the world of firefighting, emergency medical services, and the like, EmergencyFD Storyline's goal is to educate, inform, share, and inspire you. There are many stories coming, and we'll have more of that in the future. Due to the recent pandemic, this is an EmergencyFD Storyline Extra. Our storyline is COVID-19, told by 3 guests, while at the same time, we social distance. There are many acronyms that surround our first responders, and which is pretty much true in most industries. The world knows about PPE, that's for sure, personal protective equipment, but there are SOPs, standard operating procedures, and PSAPs, that is, public sector answering points, the communication dispatch centers or 911 centers here in the United States. With me on the phone is Raymond, the Executive Director of the Shelby County 911 Emergency Communications District. Raymond, glad you could join me.
Thank you.
Hey, I know you've been very, very busy and a lot going on. How has this COVID-19 virus crisis kind of affected your job and what you do in the 911 system?
Well, for our district here, we're more of the administrative branch where we responsible for all the 911 premise equipment and all the PSAPs throughout the county here in Shelby County, Tennessee. Public safety answering point is PSAP. It's the dispatch center, all the dispatch centers. Luckily, most of our PSAPs, we have backup PSAPs. Each one of them have a backup PSAP in each municipality. They're having their centers commercially cleaned and desanitized 3 times a day, the larger PSAPs, and some of them are doing like 3 times a week. And so the local 911 district, we're going to pick up at least 75% of that cost for all the PSAPs in the county, public safety answering point.
How many actually agencies are served there, just before we get back to what you're talking about?
So we have Memphis Police is our largest PSAP. They have about 26 call-taking positions, 10 or 12 radio dispatch positions, and a couple other record positions and Station B positions. We have Memphis Fire, secondary PSAP, the City of Memphis. They dispatch fire and EMS. We have Shelby County Sheriff's Office is primary PSAP for unincorporated parts of Shelby County, Tennessee. And Shelby County Fire Department handles fire and EMS service for unincorporated parts of the county. Then we have the City of Germantown. Germantown Police has a PSAP. Town of Collierville, they have a PSAP, the Collierville Police. We have City of Bartlett, the Bartlett Police Department PSAP, and Millington, Tennessee, City of Millington has a PSAP. So we have equipment in each of those PSAPs, and if you're in those locations, your 911 call route to that agency to handle.
Wow, so that's an awful lot. So really, it's been kind of more of an internal thing you've had to deal with lately, correct?
Yes, it is, and just making sure all the equipment. We're lucky we set up over the last 10 years where each PSAP has a physical backup PSAP. Memphis Police and Memphis Fire, we've remodeled the space, and in the last 10 months, Memphis Police and the district, we've been fixing up their alternate PSAP. They're staffing both centers at this time where they're spreading their employees out just to try and reduce the chance of something happening.
So that's really the major issue is internal. Have you had any problems so far internally with people actually contracting the virus at all?
We've had one that was out of PSAP that was positive, but that's taken care of. And some of the municipalities, they were testing people if they'd been out of town from certain locations a couple weeks ago. And there are a couple of people that if you came from those locations, they would quarantine you for 14 days.
The folks who are taking the calls and doing the screening is for 911 to route. Are there having to change any protocols or SOPs in that process right now?
Yeah, the PSAPs, most of them all are, they started probably 2 weeks ago. Every employee that comes in, they take their temperature before they come into the dispatch center. And if they have a certain temperature, if they have temperature, they're going to turn them away and have them go get tested. If they're okay with no temperature, then they'll go on up to the dispatch floor. They're actively doing that at all the PSAPs here in the county. They're having the facilities commercially desanitized regularly during the day.
And has it affected anything as far as dispatching, or shall we say routing the calls, not necessarily the people, but have you had to change anything you say?
It has not affected that at all now. Most of them are wearing masks. They're encouraging them to wear masks. So some of the radio transmissions, I think you can tell they're a little bit muffled or sound low, but I'm sure that's what it is due to the dispatcher wearing a mask.
And in the system, has there been like an overwhelming number of calls about the COVID-19?
What we've seen has been the actual total number of calls it was remaining the same. And the last day or two, it seems like the calls have gone down some as far as the total number of calls coming into the PSAPs. They were kind of steady there for a while. In the last day or two, it seems like they've kind of gone down just a little bit. I guess that's encouraging, getting more people to shelter in place. All the municipalities in the county here, they've had a shelter in place. It's a statewide shelter in place now. Safer at home.
Has there been I know where we are, they set up a bunch of hotlines, which I think have taken a lot of the phone calls away from the 911 system, answering questions about it.
The health department here has a phone number you can call, and they've actually put out information, if you have symptoms and stuff, they're taking drive-through testing. They selected one site to build a hospital, so they're looking at that and probably will begin that process probably before not too long.
Just the fact somebody else is helping answering questions, and that kind of takes some pressure off the system?
Yes, we're trying to keep it where we don't overload the 911 system or anything, and have it where those people call the health department or other numbers they've established to get information.
You were mentioning just a little bit earlier how you've had these upgrades and renovations in the communication systems with Memphis Police and Fire. Has that really made a difference as far as just the way things operate now?
Yeah, Shelby County, we're lucky we've been pretty advanced the last couple of years. 2 years ago, we completed the latest upgrade to our Wiliams Motorola Vesta 911 calling solutions. Other features with it, anyone that's on an iPhone with ISO 11 or greater, or any Android phone that has operating system of 4.0 or higher, before the call taker answers the call, they can see the call show up on their map, actually show a breadcrumb if you're moving or in a car, and show you traveling on a map that we have displaying it at the call taker position. Other technology that we've done too, or actually the transcription of the call stuff that's coming across, and they can monitor it in the EOC, testing it out, and they're developing it at this time. We have text to 911, where all of our PSAPs in all of Shelby County now, you can text to 911. At the larger PSAPs, like Memphis Police and Fire, we have an abandoned callback where someone calls 911 or accidentally calls and hangs up before we answer it. Well, a computer calls them back. Memphis Police PSAP, they just ASAP to PSAP.
Real quick question. I know this the public safety answering point is a PSAP.
Public safety answering point is PSAP. It's the dispatch center, all the dispatch centers, right.
ASAP what is that?
ASAP stands for Automatic Secure Alarm Protocol. I believe Memphis Police gets about 45,000 alarm calls a year. An alarm goes off. The alarm company doesn't actually dial the police. It actually just sends it in, and it goes into the computer-aided dispatch system. So we have some pretty advanced things that we have going on
Back to a little bit of the this COVID-19. In times past, you and I have talked about WMDs, weapons of mass destruction, but I don't know if we really thought about the word of a pandemic. Was there a lot of pre-planning with this, or just as this is just one of those things that just kind of hit everybody by surprise?
I've been out of the PSAT for almost 20 years now in June. So I don't know how much they planned on something like this. We know we have our equipment. We have backup PSATs we planned for over the last 10 years and created backup centers where each agency has a physical backup where they can go to, and they can work at either one and answer calls at the same time or just from one of them. So that's the benefit of our system. We have geodiverse servers. So say for one city, they'll have a server at one location, another server at another one, and they're tied together. They can go in any of those centers and log in and answer their 911 calls. That's the big advantage we have, and it's helped a lot with that. Most of the agencies are having them report to both locations and work in two different locations to try and keep the people separated.
I mean, we had to keep the folks in communications safe, just like everybody else out in the field as well.
Yes, we started doing the disinfectant and stuff. I mean, I'm sure the district will probably spend, upwards of $1 million probably on keeping this going for a couple months. Hopefully this passes.
Any advice for anybody else around the country in this particular situation we're all in?
I would just make sure they're taking the temperatures of people reporting to work and probably offer them the mask, have their centers disinfected routinely through all this as much as they possibly can.
Raymond, thank you for talking with us and do appreciate the time. We will be talking with you later.
That sounds good, Tom.
We've been talking to Raymond Choizza, the Executive Director of the Shelby County, Tennessee 911 Emergency Communications District. You're listening to EmergencyFD Storyline. In the United States, we call 911 for an emergency. In other parts of the world, it's 000, as found in Australia. And to find out what's going on in another part of the world, right now with me is someone who's way down under from where we are here in the U.S. David Moore, he's the Senior Station Officer for CFA, which is the Country Fire Authority. And David, thank you for joining me. You mentioned to me earlier what CFA is and where you serve. It's in Victoria, correct?
That's correct. Thanks for having me on, Tom. So the CFA, the Country Fire Victoria, we basically provide fire service to all of Victoria, a state in Australia. We do a lot of urban firefighting, structural firefighting, plus also wildfire firefighting as well. So across all the bushlands, the fires, I'm sure that you've heard that devastated across Victoria and New South Wales. We were heavily involved with that last summer. And of course, 10 years ago, we had the Black Saturday fires, which completely devastated the state of Victoria. So yeah, we've got quite a broad breadth of territory we cover in the Country Fire Authority.
That's a lot. That's amazing. And I am wanting to get back with you because we are wanting to talk about that and a lot of lessons learned and what you guys went through with that. Right now, we're dealing with the COVID-19 pretty heavy here in the U.S. How is it going there for you, and what are you doing to help prevent what's taking place with the COVID-19?
Well, unfortunately, this virus is a global pandemic, and it's even affecting way down here in Australia. So we're so far away from everyone. Everyone says how long it's here. Well, COVID's already introduced itself, unfortunately, to us. We are, along with the rest of the world, we're practicing social distancing, ensuring that our hygiene is better by washing our hands and constantly, wherever we're going, to wash our hands and to make sure we don't have that social interaction and that contact on a day-to-day basis with people. So it's very similar to the rest of the world. Our measures seem to have been flattening this curve, which is fantastic. The main thing we need to do as a community here and also around the world is be vigilant and continue to do these measures, because unfortunately this virus just won't go away. We have to wait it out and deal with that.
As a senior station officer, I know Hero was mentioning that it's very similar to being a lieutenant at a firehouse here in the United States, or a captain or one of the officers. What are you concerned about with your rank and file, your members? And a little more specific, what are you doing with PPP? Anything different? Any of your personal protective equipment that you're dealing with? Any new protocols you're putting in place to help prevent and keep your team safe?
Yeah, that's our number one priority, is to keep our members safe, because we have only a finite number of resources, and if people are becoming infected by this and have to be isolated or possibly hospitalised, our numbers will reduce down, and we can't provide that service. We're still going to provide fire services. Still going out to incidents. So the number one thing is to try to keep our members healthy and keep our members isolated from this disease. So our PPE, where we have changed, is when we have that contact with individuals at incidents. So at car accidents, at areas where we have to get face to face with people, we are wearing the P2 masks. We do wear gloves anyhow, as we do, but we do provide a service called emergency medical response, and that's going to people who have had a cardiac arrest, so no pulse, no breathing, where we physically have to get hands on the person, and we don't know their situation there. We do have to wear full masks, goggles, double gloved, and a Tyvek suit over the top of our original gear. And this is just to create a physical barrier. So if there is any contaminants that we can strip down, get rid of those, notify our rostered duty officer of that potential exposure, and then disinfect and clean the appliances and ourselves as well. So that's our main our main concern, is actually that contact where we don't know whether or not these people have been affected by COVID-19 or not. And we've been very stringent with drills, practicing, taking the gear off to make sure, and operating in the gear. It is quite restrictive. Yeah, but we're still providing a service. If people are out there, with these conditions, we're still out there, trying to do that. We're just protecting ourselves as much as possible.
At CFA, a portion of the firefighters are volunteer and full-time. How does that work, and how does that affect your response with COVID-19?
Yeah, so there's approximately 1,000 paid employees, and there's around 60,000 volunteers. So those volunteers are more in the rural areas, or not in the cities. So we have the paid staff who deal with response in the cities. The volunteers have the same protocols as we do. They don't do the emergency medical response incidents, so their exposure to that is a lot less. However, they are still dealing with members of the public. They still have to go out to certain instances, so they do have a requirement to ask certain questions. Have you been overseas? Do you have the effects of the flu? Have you been in contact with anyone who's got COVID-19? And then from there, take measures in place. So it's not just for the paid staff; it's for the volunteers as well, to ensure that we have that workforce healthy as well.
The kind of apparatus you respond with, what do you have in your typical engine house? What do you have there?
So at our engine house, we actually have two pumpers. I believe you call them pumpers. They're all engines. And we have a ladder platform.
What do you call them there? What do you call them in Australia?
They're called a pumper. We also have an aerial appliance, or a ladder platform, or cherry picker. So that goes up 42 metres, or I'm not quite sure how high that is in feet, but 42 metres in height. And we have a road rescue unit, which does cut out for cutting people out of vehicles. Within that appliance, there's also specialist rescue gear. So we do rope rescue if people are on the edge of a cliff or down a mountainside, confined space rescue, and trench rescue. So at our station, or our firehouse, we've got quite the specialist gear there. We service a large area around the Geelong. Where we are in Geelong, we service that whole area there.
And Geelong, by the way, is that right on the coast? I know that Tasmania is to the south across the ocean there, but then you guys are on that southeast corner. Is that correct?
Yes, that's correct. So we're just about an hour's drive from Melbourne. If you head down the coast, it's I think a lot of people refer to it as God's country. It's beautiful down here. So some people may recognise it from, we have Bells Beach. There's quite the surfing area. So there's Bells Beach and Torquay. So it's quite internationally renowned for that. So we're about an hour south of Melbourne, or southwest of Melbourne.
This is an off question. Do you have to deal with any of the shark problems? Is that Great White Area?
Unfortunately, yes, it is. And I haven't had to deal with it myself. So,
anything that you would like to pass along, I guess, to your fellow brothers and sister firefighters, emergency medical personnel here in the U.S. about this whole issue with the COVID-19?
All I can say, I'm not going to really give advice. I'm just going to say, just keep strong, look after each other. This isn't going to go away very quickly, so let's make sure that our morale and our headspace is in the right place, because the only way we're going to be able to defeat this thing is together. And I'm sure that the other emergency service personnel there in USA are doing a fantastic job. So heart goes out to them, and everyone keeps safe.
All right. Thank you, David Moore, Senior Station Officer at CFA and Geelong, Victoria, Australia. Thank you for being here.
Thanks very much for having me.
This is EmergencyFD Storyline. You know, most fire departments in the United States are rural departments, many staffed by volunteers, sometimes paid on call. Most have limited resources and a finite number of full-time personnel. The absence of one or two firefighters due to COVID-19 could have a big impact on most fire departments in the country. We're closer to home in southern Illinois, where I am. We have the home of Superman, Metropolis, and with me is Bobby Wiliams, firefighter with the Metropolis Fire Department. He's also an engineer, training officer for the Metropolis Fire Department, and you're a field staff instructor for the IFSI, which is the University of Illinois Fire Service Institute.
Correct.
And for those who aren't from Illinois, what is that?
Oh, Illinois Fire Service Institute. Yeah, and that's with the affiliation with the University of Illinois. I'm like a lot of the other guys throughout the state. We're part-time staff, we're field staff, so we'll either teach classes there on site, on campus, in our respected areas where we live, and we'll travel as well.
Fire suppression is the focus there, is that correct?
Fire suppression, hazardous materials, technical rescue, whether it's collapse, trench, ropes, confined space, arson investigation. I mean, it's across the grid. You know, officer classes, officer development, as well as behavioral studies, mental awareness, along those sorts. Resiliency. We do a lot of stuff with resiliency program.
Tell me a little bit about Metropolis Fire Department. Very typical across the United States. How is it made up? How are you guys dealing with this challenge of the COVID-19?
We're a small department, you know, and initially, I think like a lot of places, it took fire departments, big and or small, by surprise and weren't necessarily prepared for something like this magnitude. You know, I talked to a buddy of mine in central Illinois. They were pretty well prepared. I mean, they had stocked up like 2,000 N95 masks and gowns and things of that sort for something like this. Not everybody's prepared like that. You know, we certainly weren't. Until we got the equipment, you know, that we could, the PPE, the gowns, the glasses, the masks, especially, you know, with the N95, we were kind of put on a standstill if it's only dire only because we weren't prepared. We still only go if EMS requests us. Like for our services here, there is 2 ALS ambulances. One is on for 24 hours. The other one is only from 7 to 11. So if they get a call, because they cover the entire county for Massac County. So if it's gone, we're all the city has for emergency medical.
That's quite a few challenges. Has it changed any of like your SOPs, or you're just paying more attention to what you're doing in every call?
Absolutely. I mean, you have to mask up every time. The medical response for us has gone down because we're not going out on everything that we did before, helping even with the elliptic assist, you know, which the public, that's what they expect from us. We're not doing that now for right now because of what is going on in this day and time. Had we known, and dispatch has gotten better about if somebody calls 911, they call in, they'll ask them if they've had flu-like symptoms or running any kind of fever or anything, and dispatch will relay that to us and EMS if they get called and have to respond. So we know how to prepare ourselves and dress in the PPE that we need should we come in contact with this COVID-19.
Somebody brought this up, is the fact that if somebody gets the COVID-19 in your department, I mean, what would that do to Metropolis? And you're typical of most of the fire departments in the country.
A fire department is a fire department is a fire department across the board. We all have the same job. The only difference usually is the numbers and staffing. So it would be detrimental to us because we only have 8 full-time guys. So one of us gets it, Obviously, like me and my partner, my captain, we're, one or the other, we expose each other, we're out of the game for at least 14 days. So then that shortens and that puts the burden on the rest of the guys. And hopefully, and then there's, and we'll get into the station cleanup here in a second. But I know, was it 2 weeks ago, maybe? A buddy of mine in Central Illinois messaged me and said one of the guys, but was on shift, found out he had it. He tested positive for it, and they found out. So that entire house had to go home. So 7 guys had to go home, and they had to be quarantined. So 7 guys at one firehouse, they had to go be quarantined. I know that's happened several places throughout the country where guys have, and they just may be asymptomatic, but they tested positive for it. But you have to be quarantined until it's gone.
And that's a big challenge. And that gets into the idea, I guess, of the social distancing that everybody's supposed to be doing. There's many reasons for that, because you may come in contact with it, not necessarily on the job, but when you're not on the job, and that becomes a problem.
Oh, at a gas pump,
Yeah.
at a grocery store, at a convenience store. I mean, it could happen anywhere right now, the way that it's going right now. I know, because I was sick for like 2.5 months and I couldn't shake it. Went to my doctor and he gave me a couple of things, gave me a steroid pack and something else, and it kicked it for a second, and then came right back, and it ran its course, so to speak. And then a follow up that I had with him maybe 2.5 weeks ago, we were having this conversation about how we think it's been around longer than what they're saying or what they believe. Because he was sick, he was super sick. There was a 32-year-old New Jersey fireman that died from COVID. Chicago firefighter that just died. He was 49. I'm in pretty good condition. I stay fit and everything. And it's worrisome. There was a Terre Haute, Indiana fireman that just died, 41 years old from COVID. And then you see the range. You see that range to the 80-year-olds, and I think there was even a 93-year-old I saw somewhere that contracted it and recovered.
I saw a 101-year-old did fine. Yeah.
It's just different how everybody reacts to it. Underlying health problems or not, and it's scary, and everybody should be scared and take it seriously. To me, I've not seen my girls for 3 weeks now, maybe. Because I don't want them near me, because I'm still out and about, and because of my job. The biggest thing, the social distancing, people need to take it serious, and it's not a hoax. It's not a,
there's a little bit of fear, I think, in the back of everybody's minds right now with it all, but has it really changed the way you do your job?
Medically, as far as medical response, it has. Even, the daily day there at the firehouse, because we keep it locked down. Visitors are not welcome. They can't come into the firehouse and visit like so many do. People will stop at a firehouse and go visit the firemen, and especially with us having Superman, and we have the old the 1926 American La France. It's has its own room. It's glassed in, and that a lot of people like to come and look at, because that's a piece of not only history of Metropolis, but that's American history, and all that's changed. And we have a daily routine where, as is a lot of fire departments, you wipe everything down, door handles, clean the bathrooms, you wiping down the phones, the countertops, the chairs, anything that gets touched, it's got to get wiped down on the daily. Your bedding, you got to wash, making sure guys get, wash their bedding regularly, more regularly than than what should be done now, especially. And then if you do go on some kind of cause, or if you're out, making sure that guys have changes of uniforms. If you've been inside a store or a building or a house, whether it's a fire alarm or whatever, if you go to a medical, and if it's whatever, a shooting or you're having CPR in progress, or you get some vomit on your pants, where okay, uniform comes off, goes into the water, you wash it, you change out, take a shower. Too, we don't run an ambulance. Think about the departments that run an ambulance.
You think this is going to change for the future, just your SOPs or how you do things? You think this may not be the first?
I think we would be ignorant if we didn't, just because of what we're seeing can happen. I think we've been pretty laxed. We've been pretty lucky But I think this has been an eye opener. And again, I can't speak for everybody, but I would say that most everybody would be on board. And again, we don't even run an ambo out of our firehouse. The people that are running ambos, they're having to take more precaution because they're transporting, and they're if they are transporting, they're in close proximity to that infected person, with this COVID.
So you got any advice for other firefighters and fire service personnel around the country? What would you tell them?
Wear your stuff. Wear your stuff. I remember a chief one time saying, "Well, you can't train for everything. You can't be prepared for everything." Well, as long as you're on the job, that should be your goal. You should keep on training up until you retire. If you don't, then you need to put your papers in. With that, certainly don't need to be there. Wear your stuff. Be safe, and especially with this COVID-19, people were caught off guard. We weren't prepared for it.
Well, good stuff. Bobby Wiliams, firefighter with the Metropolis Fire Department, training officer for the department as well. Thanks so much.
Thanks, Tom.
You've been listening to EmergencyFD Storyline. Our storyline has been COVID-19. If you would like to contact EmergencyFD Storyline with your comments or to suggest a story or subject for an upcoming podcast, just email us at storyline@emergencyfd.com. That email address again is storyline@emergencyfd.com. Also, check out our website, emergencyfd.com. On our website, we will have more information about upcoming documentaries and videos and ways you can support future podcasts. I'm Tom Mann, your host, and I want to thank you for listening and thank our guests for their time and perspectives. There are many stories coming on EmergencyFD Storyline, so be sure to join us. EmergencyFD Storyline is a production of Mann Voice.